Welcome to this edition of Let's Talk, presented by the Visiting Nurse and Hospice for Vermont and New Hampshire. My name is Anthony Knox, and I'm the Community Relations Manager for the Visiting Nurse and Hospice. And this is the first of many presentations that we're going to be presenting to you today to talk about all of the different aspects of the Visiting Nurse and Hospice, not only just from our organization, but as a whole, what to expect from in-home supports from visiting nurses, whether it's us or another local agency. But for today's presentation, we're going to be talking about donating to the Visiting Nurse and Hospice for Vermont and New Hampshire, the different ways in which you can do that, how it helps our organization, and just be able to talk about all the different facets of it. And so today I'm joined by Lisa Orlandini, who is our fundraising guru here, and she'll give you a little bit of her background and official title and all of that good stuff. So Lisa, thanks for joining today to talk about all of this. And why don't you jump in with a more in-depth introduction?
Sure. Thanks, Anthony. Thanks for having me on today. And I'm excited to be here to share what I can. So I actually relocated to Vermont just over a year ago to start with VNH. I am the donor engagement officer. So, I was, prior to that, my first professional life, I was in the IT industry. I was a computer programmer analyst, and then found my way into healthcare and predominantly in home health, hospice settings, and in assisted livings. In my last position, I was the director of a nonprofit cancer and wellness center. So I had been involved in various ways in some capacity with fundraising efforts and engaging with donors. So this is a first time full focused opportunity for me. So I've been learning a lot, and I just love the area. I was smitten with Vermont back in my 20s, which, was just a couple years ago, but had always wanted to come in and live in Vermont. And so I'm sort of fulfilling a life opportunity, checking off the box, and I've just loved it. People are great. And of course, the Visiting Nurse organization is a phenomenal organization. So I'm proud to be a part of it.
Awesome. Well, we're happy to have you be a part of this team, and for everything that you've done leading up to this, and everything that you've been able to accomplish since you've been here has been absolutely wonderful. So we're gonna dive in now, and let me get this presentation up. And so Lisa, take it away and tell us all about donating to the Visiting Nurse and Hospice.
Thanks, Anthony. So I called our presentation today, The Heart and Sense of Giving, because I think I find personally, and just in talking with donors that I have been able to chat with, that I think there's sort of a call within yourself of why you support particular programs. And so that's where your heart comes into play. And I think that's where I wanted to get that link and that passion and that reason behind the money. It's not just about the dollars all the time. It's really about what motivates you. And the sense part, of course, is the common sense of it, as well as the financial piece of it, of why, your dollars, why somebody's money coming toward us makes a difference. And it is important. It's impactful. From something small to something large, every bit of it counts and every part of it matters. And so that's just kind of the summary of the heart and sense of giving for the presentation topic today. So I'm going to go ahead and move on to the next one and start with the heart of it all. And the heart of giving, what I did want to just explain a little bit about, because I do sometimes find in talking with individuals, they're not fully aware of the breadth of services that we provide. So our care of life diagram on the left really shows the spectrum, all the way from maternal, child, pediatric care, to what more people understand about home health care services. Our end of life program, of course, hospice is well known. And then we also have our long-term care program that assists individuals in the community that have a chronic disease to actively still live within their own home environment. And so we provide support to that. So anyway, I just wanted to touch upon that a little bit, because again, that brings back the heart, like what particular piece of our services has touched upon your life, and why would you want to give to us? So based on that, the first idea is, why do people give? What is part of the heart behind some of people donating? And for some, it is that personal connection. They've either personally had firsthand experience with services from us post-surgery, whether it's knee surgery, whether heart surgery, whether it's physical therapy, occupational therapy, wound care, they personally may have benefited from it, as well as their spouse, because maybe if they have a spouse, their spouse is the one helping to care for them as well. Our services provide relief and clinical care to that whole extent. Or maybe they witnessed firsthand a family member or a friend receiving benefits. I know for myself and my family history, I've had my father benefit from end-of-life care. He was on hospice for almost a full year and received the benefits, which were beautiful. And obviously, as a daughter and other siblings and family members were able to take part and be guided along in the process. And my mom was also provided hospice services as well as home health while she was living with stage 4 colon cancer. So for me personally, there's a direct connection for me working here. And for some people, the donations come in honor of someone. Maybe they, again, received incredible care from a staff member or observed incredible care by a staff member. So people may contribute in honor of one of our staff members or in honor of somebody in the community. And of course, there's the donations that come in memory of someone that we cared for that has passed. So that's sort of a little bit more of the personal connection behind it. And, you may have also experienced, Anthony, in your own life, the benefits of our services for family and friends. And so you might have a direct connection to that as well.
Absolutely.
Yeah. So the other point that I bring up is the fact that I've also encountered people that are professionally in the healthcare industry and personally understand from that working scene kind of thing, the benefits that providing services in the home makes a huge difference. Dr. James Burnett was a neurologist with Dartmouth Hitchcock for over 40 years. And his perspective was that seeing people in their home environment gives you a totally different view. It gives you the whole perspective of the human being, not just that clinical setting that you get a sort of a snapshot of what's happening with that person. So they get an opportunity to see the whole patient and help identify factors sometimes that actually can prevent someone being hospitalized unnecessarily or rehospitalized. So again, and there's also some studies or information about the recovery time that happens when you're in home and in your own comfortable setting. So that's sort of a healthcare perspective, why people may choose to give to us. For another example of, people trying to understand, like, what is the benefit of home care? I just was reading about some of our home health care teams weekly review of events. And we had a nurse in the home who was doing wound care and noticed that there was some tunneling happening with the patient's wound. So they were immediately able to get on the phone with the vascular team, get a follow-up appointment, and have it addressed right away. Had our team not been there and had things progressed, further serious complications could have occurred. So we're an extra set of eyes and ears in the home to be able to do some preemptive work. I also, hear and see things about, the review of medications when we come in and seeing that meds were changed and there's an alteration in the personality or in the patient's demeanor, or maybe there's a consideration of meds needing to be addressed or changed. So it's just that extra set of eyes and ears in the home that's really, really beneficial. And, I was just sharing with you a little bit beforehand, when I got to shadow last year with one of our home health nurses, I was able to meet with a patient who had just had surgery and had part of her toes amputated. And she had a beautiful German Shepherd dog. And the dog was diagnosed with lupus around the same time of the woman's surgery. And so the dog needed to go outside a whole lot more. And with our patient trying to recover and trying to get rest through the night and not being able to and having to get up during the night with, addressing getting through the home and helping to take care of the dog, our nurse being in the home was able to see this dynamic happening and was able to recommend a basic little screen that the dog would be able to allow herself to get in and out of the house safely. And so the family member's brother came in and installed that. So, it's just those little things that when the woman was discharged from the hospital, how could the staff at the hospital even realize that might be a thing? So the resolution came into play, and she was able to get more rest, and the dog was able to take care of her own needs, and everything went really well. Yeah. So, it's just, again, even with my mom, having somebody else come in and offer perspective, because when you're in the mode of caring for a loved one, you're so focused, you sometimes maybe miss some things that are obvious to another staff member or another clinician coming in that might address a safety issue. So it's really important that we're able to provide this.
And I think you nailed it on the head as well, is that, for the care that we provide, and like I had said at the start of this, we're going to have several different presentations regarding all of our services and what they look like and things like that. But part of the beauty of in-home supports for an individual is that it's where you're going to be the majority of your time. You're not, you may go to a doctor's office for a half an hour, you may go to physical therapy for an hour, or whatever the case may be. But being able to get that sense of, this is how I'm going to be able to function in my own home, and here are the medical professionals to be able to do that, is key.
Absolutely. Yes. Very good point. Absolutely. And the other particular perspective for some people in the community is that, they're just community-minded individuals who want to support local organizations and recognize the significant role that we play in keeping a healthy, vibrant community. And, in having conversation, and you spoke with Dr. Robert Welsh and interviewed him on Let's Talk, and he's a medical anthropologist and a former professor who just appreciates that in order to keep the communities vibrant and healthy, VNH is a vital part of that, and we need to keep VNH up and running, is his perspective. And he actually even said it's just a no-brainer, to make sure that our agency thrives. Because if we thrive, then obviously the community, that the people that we serve, thrive, from moms and babes to end of life. And, just kind of the catch-all bottom is, other personalized reasons. I'm sure there are a variety of reasons people do their charitable contributions and their philanthropic efforts. And I just know for myself, whenever I work for an organization, I tend to support it in whatever capacity that I can. So I know there's, United Way that allows for people to contribute through their employer and things of that nature. So by no means is this an inclusive, the whole crux of why people donate, but it was just some of the main reasons of getting to the heart of why people may want to sit and listen to what we're talking about and consider, possibly contributing to our visiting nurse organization. So to move on from that is to kind of tie into making sense of giving. So first of all, obviously, we are a nonprofit and we are a 501c3 classification, which means we can receive donations, and that for donors, they would be eligible to deduct their contributions to us. Obviously, they'd have to work that with their accounting, depending on how they file their taxes. But because they donate, they would be able to look into that. And, so part of tying into all of the services briefly that I've talked about and what motivates giving, the dollar and cents of our reality is we're a nonprofit and we are not operating in a profit mode. Majority of you can see almost half of our funds in 2021 came from Medicare insurance reimbursement for the services that we provided. You can see 25%, the next larger chunk, came from investments that have been made over the years. We actually received some extra COVID relief, and then general operating revenue as well. Excuse me. And then, we get to the smaller percentages of where our monies come from. And the 3% is where I want to kind of focus in a little bit on. The cities and towns that we get funding from, which is terrific. We were out there the other day getting the signatures of the voters to make sure that we're on the ballots to continue to get subsidized by their cities and towns. And then there's grants, of course. And then there's the donor contributions. So overall, the majority of our monies come in from insurances, albeit Medicare, private, or Medicaid, and then a small percent come from cities and towns, donor contributions, and the grants. And that's the area that, by having this conversation today, we're hoping inspires individuals to recognize how they can make an impact. They can change that 3% and help us build up and have a larger foundation of money coming from the private sector, coming from the communities that we serve, in order to keep us available to them for whenever they may need it. Somebody listening today may not have had the benefit of our services, may not even know somebody who has had the benefit of our services, but appreciates and understands how important it is to have these services available, much like Dr. Robert Welch does, and contribute to keep us vital, because at some point in life, you never know, things happen, and we may be coming to your home without you having planned for it. So it's important to keep us. You can see that we're under the Dartmouth Health logo there, and we are part of the larger Dartmouth Health. There was that whole initiative that just came out earlier that we are a member, an affiliate, a member of the Dartmouth Health system. However, we are still fiscally independent and financially responsible to maintain our own income and expenses. So I kind of jokingly sometimes say it's like the kids of the family. Dartmouth Health is mom and dad, and all of the affiliates are the children. And at some point, everybody's independent, and so we're independent. So we're grown up children needing to take care of ourselves at this point in time. So in donating to VNH, you're donating to us. It hits us and our bottom line directly.
Exactly.
Yeah. Let's see. Let's go to the next slide. And so. Actually, I want to just, I'll talk about it in this one. And the act of giving, as I mentioned, no amount is too small or too large, for sure. So, we have individuals that give X number of dollars on a monthly basis, and that's hugely helpful because we know we've got that loyal base of money coming in. So even if it's $50 a month, we know every month $50 a month is coming in. And if you had 500 people doing $50 a month, that's a nice steady stream of income that we can rely on to keep coming in every month. So if you're listening and you're saying, I don't know how much I could give, if you need to spread it out over 12 months and it's X number of dollars a month, that's still very noteworthy and impactful. Other classification is a one-time gift, which just means there's no set plan of a continuity of that gift. So you may just give once and never again, which I hope you don't. Or you may give once or twice a year, every year, but it may vary on when you give it and how much you give. So it's not quite the same as that recurring gift idea. And the other thing, I'm going to skip over the methods for a second. The other way that you can potentially give is through stocks, bonds, mutual funds. You can work through a donor advised fund. There's a lot of foundations out there that can help you along with that. There's a lot of estate planning that can be done, and legacy gifts by naming us as the beneficiary to a retirement plan, to other like life insurance, et cetera. There's other ways that you can plan ahead to be able to contribute and donate to our organization, and would be a very powerful, impactful way as well to give to us. There's also fine art, quality coin collections and various ways to think about it. So I just wanted to kind of, and again, it's not all an exhaustive list, but it's just a list to sort of start having people think about, like, what could I do in order to help and support us, both now and in the long term. And so these are just some ideas to get people thinking about what can be done and how you can help us out. And just for an example, like a little bit more concrete, maybe, we just calculated, we're doing some conversations about helping to formulate some stories and ways to help donors understand kind of a direct connection to their contributions. So we just looked at what it cost to supply one of our home team nurses with their basic supplies they need to have on hand in their car, in their bag, in order to make their visits and have product available. It's about $1,000, just under $1,000 per person, per nurse, to get them the fundamental needs or the supplies they need to be able to get out and get on the road. So, that can add up, whether you can give the donation $1,000 unrestricted, or whether you are a part of a bunch of people that can contribute and total it up to $1,000. That's just one way to look at framing, your impact. And we kind of like to get unrestricted funds because that just helps us to appropriately apportion the funding overall. But certainly we do sometimes get restricted funding in for specific programs that are available. And what else do I want to say on this one? So the address checks obviously can come in. And our corporate office here is at 88 Prospect Street, White River Junction, 05001. And or go to our website, vnhcare.org, and you can do credit card or PayPal there if either one of those works better for you. Wanted to see if I wanted to touch upon anything else on this. Any other thoughts or questions or comments maybe from your side, Anthony?
So the only thing, and I know you talked about it a little bit, but just the restrictive funds versus unrestricted funds, and could you kind of explain a little bit more as far as potentially how that would look for donating, and if there's any differences as far as how that money comes into the VNH.
Right. So the channels of coming in are all pretty much there. I mean, we do actually can receive electronic fund transfers as well. So basically, most donations just come in, whether it's credit card, PayPal, or check, and it's just whatever the dollar amount is. Maybe it says it's in honor of someone. Maybe it says it's in memory of someone. Maybe it doesn't say any of that. Maybe it's from an appeal. But all of that just comes in. It goes to the general operating, general fund that we have. And that means that it just becomes part of our total income that comes in, like we saw on the pie chart. And then it just gets, put against the general expenses overall. We do have, for example, our nurse residency program, which is a very innovative program that started in 2020, where it takes a recently graduated registered nurse and has them shadow and learn and experience what it's like to be on the road as a home health nurse for a year. So they'll get to experience the various departments and services, get educated in a deeper way that provides an incredible opportunity for them educationally, professionally. When we're doing that, we're paying that nurse to be a part of this program. They're not paying a tuition to us. So that's a net expense to our bottom line, though it's very vital because often these nurses go through this program and stay on board with us. And with the healthcare shortage that we're experiencing, with having to ramp up hiring traveling clinicians, which has been a huge hit on our bottom line, being able to nurture and develop graduating nurses that are in the area and hopefully maintain their professional stay with us is a wonderful benefit, but it comes at an expense. So this is one area where we have sometimes had donors say that's their heart in wanting to give to us. And so they'll say, please restrict this money to go toward the expenses for the nurse residency program.
Gotcha. Okay. I think that's a perfect explanation to be able to talk about, each of the types of funds that could be coming in.
Right. Thank you. Thanks for that question. That's a great question. And the last item on here, I don't want to forget to get back to, there is also the donation of your time. So we're talking about the financials. There's also the experience that you could bring as a volunteer. We have a hospice program, and we're looking to expand the volunteer base there. So if you have the thought of wanting to visit with patients, to be that type of connection for them, it's a beautiful way to really share your heart and to be able to just be with another human being in that stage of life. There's wonderful benefits to being a volunteer in the hospice program. As a companion volunteer, there's also administrative volunteer needs, whether it's for the hospice program, whether it's for other, administrative needs that we have here on site, or whether it's to help out with events that we'll be putting on in the community. Consider giving your time if you don't have the ability to financially support us. That's an invaluable tool and a valuable asset as well. So something to consider. And if anybody was interested in that, you can certainly give us a call, and we'd help you out with that. And our number is 888-300-8853. Am I right on that?
Yep.
Okay, great. And so, kind of sort of settling in at the end of this is the old question: will you support us today, and in what capacity? So again, to get back to it, you can go more specifically to vnhcare.org/donate/ or you can mail your donations to VNH at 88 Prospect Street, White River Junction, Vermont, 05001. And our number there, we have it, is 888-300-8853. And you can reach out to me, and I'd be more than happy to help you out and answer any questions, or to connect you with, if you had some, questions about estate planning, to try to connect you with individuals that can help you out with that as well. And that's all I have to say, other than thank you for caring. Everybody, it takes a community. It's the old takes a village. It takes a community to keep a community-based organization up and running. So I appreciate the opportunity to share all that with you today. And any other questions or comments? Otherwise, thank you.
Yeah, no, thank you, Lisa. And, again, for anybody who's, watching this live or is watching the recording later, as Lisa emphasized, there's a lot of different ways that you can give to the Visiting Nurse and Hospice for Vermont and New Hampshire. That doesn't necessarily mean, dollars and cents out of your bank account. It could be just, volunteering to help out with various events or within our hospice program or things like that. And, reaching out to the VNH too, just to see, what else you could do, is also a great option for anybody who just wants to help out in some way, shape, or form. So,
absolutely.
So again, thank you so much, Lisa, for providing this presentation today, and again for anybody watching this. The month of November is Home Health and Hospice Month, so we are going to be focusing on all of the different facets of the VNH. So, check out our YouTube page to see when the upcoming presentations are happening, as well as to watch the recorded videos from all of the presentations that we're doing this November. So, and we hope to see you at the next Let's Talk, and everyone enjoy the rest of your day.
Thank you.